Okay, hello. I'm Andrew. I'm gonna be the normal physician for Sway.
And I'm probably going to be the nutritionist and one of the neurologists.
I'm Karina, and I'll also be in the neurologist.
And the mother of Sway.
So with the Cushing's disease, it's basically a syndrome that occurs. It's not genetics. It's not
Inherited.
yeah. It's
It's basically lumps around the whole body, and it also makes you look obese when you're actually not, due to the high cortisol levels in the blood that aren't supposed to be there.
23-year-old Sway Diamond has been meeting with a general physician for the past few months, tracking her obesity and discussing a diet and exercise plan. She has been following it to the T, but there has been absolutely no weight loss. Just 2 weeks ago, after treatment, she returned with no change or better result than the last time we met, suggesting there may be something more than her obesity causing her mysterious medical condition.
Hi, Sway. So basically, off of your initial analysis, you told me about your lumps and how you could gain weight for no reason, which most likely isn't anything big, but can just be obesity. So we'll perform a full hematology test that will tell us exactly what's wrong with you.
Okay, Sway. So your hematology test came back, and your cortisol, glucose, sodium, and ALK phos levels are really high, which leads me to my last diagnosis of you just being obese. I'll provide you with a nutritionist and medication to help you out through your journey as an obese person.
Oh my god.
I'm sorry. Sorry. Okay, Sway, so the medications that I will be prescribing for you are bupropion, 150 milligrams, which is a prescribed medication that reduces feelings of appetite once a day, or every 8 hours is when you have to take it. So basically, once in the morning or every 8 hours. And the second medication that I will be prescribing to you is Belviq, 10 milligrams. It's a prescribed medication that's an appetite reducer and will make you feel more satisfied with smaller amounts of food. You can take it twice a day, one in the morning and one at night. The last medication that I will prescribe to you is Xenical. Xenical, 120 milligrams. Prescribed capsules that will prevent some of the fat calories consumed from your meal from being absorbed into the intestines, which will make you feel obviously more full without eating that much. Okay, Sway, so this is going to be your nutritionist.
Hi, Sway. It's Kwan.
Her name is Quantwani Davis, and she is very good at what she does. She's helped a lot of people lose a lot of weight very quickly. So I'm just going to show you the plan that you gave me, so here you go.
So for diet plan, you're gonna need to include whole grains, fruits, non-fat dairy products, beans, lean beans, poultry, fish into your diet. You cannot have microwavable dinners, foods high in glucose, sodium, saturated fat, chips, or candy. You have to be healthy.
So, myself. Hi, Sway. How are you doing today?
I'm doing good.
All right. So this is your second follow-up. I just want to know how it's going with the medication.
They're alright.
Have they helped you at all? Like, do you feel more full, like how it says it's supposed to do?
Yeah, I feel full, but I'm still gaining weight.
You're still getting bigger, larger than you were before?
Yeah, sadly.
Okay. So what I think could possibly be happening, can I check you here?
Yeah.
Ooh, I feel a little lump. I think that you most likely have a fatty tumor because you do have those lumps, as it does say in the symptoms. So that could be a possibility. I'm gonna actually take you in for surgery, if that's okay with you and your mother.
Uh-huh.
Yes?
Yes.
Is that okay with you, Sway?
Yep.
Okay. So, basically what's going to happen in surgery is a small incision is going to be made on the lumps and removes the lipoma, which is the benign tumor that you have. After this incision is closed and the patient is sent home, we basically give you painkillers so it won't hurt at the active site.
Okay.
Okay, thank you. See you in 2 days. Okay, Sway, so this is your third follow-up with us, and looking back at your hematology report, you do have high cortisol levels and high glucose and sodium in the blood, which causes me to believe that your fourth and probably final diagnosis would be that you have Cushing's disease. So now Cushing's disease is a disease that makes you have lumps like you have. It makes you look obese when you're actually not. It's just the Cushing's disease acting on your body. So now that you have normalized glucose levels, but still feel and look the same as the first time you came in, we're going to go in for an MRI on the body just to make sure that you're fine. MRI, is that okay? You're going to have to stay really still.
Yeah.
Okay, so that's pretty good. We're also going to bring in two neurologists to assess your brain just in case there's a tumor, because with Cushing's disease, sometimes it does come with tumors in the brain or anywhere in the body. So just in case, we're going to bring in two neurologists to help you out with that. Okay?
Perfect.
All right, so also, what we were going to talk about is your symptoms. You say that you have fatigue, a large stomach, lumps on your shoulders. So, yeah, that's also what has led me to believe this. I'm going to prescribe you Midetane 3 grams. It's a prescribed cortisol level lowering drug that should be taken orally 3 times a day and should be always handled with gloves. It's way stronger than ketoconazole and only works for less than 80% of the patients. The second drug that I'm going to prescribe to you is ketoconazole, 200 milligrams. It's a prescribed drug that normalizes cortisol levels, and should be taken 3 times a day with each meal. Okay, see you next time.
Bye-bye.
Hi, Sway. So I'm Quan, and I'm gonna be your neurosurgeon. And
I'm Karina and I'll be assisting.
so basically, what you have a tumor which is in the pituitary gland, and it's near the hypothalamus as well. So because it's in the gland, hormones is all over the place, going up and down. That's why cortisol levels are high. Also, your body levels aren't working out as they should. So therefore, we're going to perform surgery by going through your nose into the gland and the hypothalamus. We're going to have to remove the tumor by sucking it out, I guess.
Oh my god, is it gonna be a big surgery?
Well, it's a common surgery, but yes, I guess you could say it's a big surgery. But you'll be fine. You have me, Karina, and the other team of doctors. So yeah, you'll be recovering. Take some medication, and if the tumor does come back, then you'll have to go on radiation, which isn't that bad. The reason why we're removing the tumor is because eventually the tumor can grow to be bigger and bigger and eventually affect the hypothalamus, the pituitary gland, and the thalamus. So we don't want that to happen, because if that happens, then it's going to affect a bunch of things more than your body.
Stay strong.